here we are with Miss Liz, honey, tan bella, and she does a laser tattoo removal. She has machines. Y'all all know that you've been asking me, Doc, do you do this? Do you do this? Do you do this? And I'm like, no, not yet. Why? Because I was waiting for the perfect person, machine, and everything for me always lines up. I don't just buy to buy and then that's it. I need to have a connection because this is very personal. This is for my patients. I do not want to harm them. And I want to speak to people that know exactly what they're doing. So that way I know what I'm doing and I could train my staff. So Miss Thing here, she's in Miami, which is great because she's in Florida. And it's BH Laser.
BH Laser.
BH Laser. And the before and afters are absolutely amazing. And so we're going to talk about her machines and what she does. How are you? Welcome.
Good. Thank you so much for having me.
Of course. Okay, so let's talk about your machines.
Yeah. So we have actually two machines. One of my newest babies is the Trinity. This one treats all colors. So even the blues and the greens, which are the most, difficult to remove.
And the blues
you can treat with this one.
Those more in eyebrows? Where do you see those more?
You could, depending on what pigment they have used in the past.
Okay.
They could turn greens and blues, but you have also multiple, colorful tattoos that have a lot of greens and blues that, people might not want to have anymore. So that machine treats all colors, okay? And then I also have the Trinity. The Trinity is a more affordable machine, but it doesn't have that third wavelength that removes the greens and the blues.
Okay.
So you would have only two wavelengths. But the good thing with both of them is that you can add this handpiece that helps you treat also scars, do skin resurfacing. You can treat melasma.
What?
With both of them, actually.
Mm-hmm.
You can treat, you can do the scar treatments and then be able to tattoo over in the area.
What does it do with melasma? How does it help?
So it treats melasma with this one specifically, with our 694 wavelength.
Okay.
It targets melanin, and it's a cold wavelength, so it's not hot, and it doesn't make people hyperpigmentate, so it won't make it worse.
I get
Right?
it.
It's a cool wavelength.
Okay. So it spreads that color. Yes.
It just it absorbs it. It breaks it up. Yeah.
Okay. And how many treatments would they need for that?
So for melasma is a little complicated.
Yes.
So they would need minimum 3.
3 sessions. That's not bad at all. And because I have so many patients that have melasma, a lot of the treatments that I have, that I offer at the clinic, they don't help at all.
Yeah.
And so 3 treatments is not bad at all. So they have to wait 6 or 8 weeks in between, or how long?
You could do 8 weeks.
Okay.
You can also combine this with skin resurfacing.
Love it.
So the DF handpiece, which you can purchase separately, also helps you with that skin resurfacing, and that combination of like resurfacing the skin plus targeting, the melanin
dead cells and
then helps.
So you're working from within and also outside. That's awesome.
Both.
How much are these?
So this one, I believe, they have a sale right now. Sophia, how much is the duality right now?
So right now it's 72,000. It's usually 86,000.
Yes. And the Trinity 140?
The Trinity is 140.
140. Okay.
And these are medical grade lasers. So this is not your typical, Chinese laser that you buy tabletop, that doesn't come with any instructions, that it's not a FDA approved in the United States, and they're not safe. They can cause a lot of scars. With this equipment, you have full support. You have engineers that come and do maintenance on your equipment. Like, they give you training. It's like a whole different.
And that's what you pay for.
Yes, exactly.
Is to have the
exactly what you
support.
pay for, and the technology.
Of course.
Because lasers are expensive. If you see a laser that is $10,000, just run away.
Right.
Run away.
Because that'll hurt, it'll harm,
Yes.
right? It's old technology. And then this newer technology, I feel that it doesn't hurt the skin as bad, right?
No, this only targets pigment. When it comes to tattoos and inks, it only targets pigment. It doesn't damage the surrounding skin. This is how safe they are.
And how about for the scars? How does it work with the scars?
So it's with the treatment with the handpiece. It's called the DF handpiece. It attaches to the machine, and then it helps breaking up that tissue. And as it regenerates, you break down
the scar tissue.
Yeah,
that's
the scar
underneath
tissue that's under
the dermis of the
yeah.
skin. That's awesome. I'm excited. I can't wait. And so I'll bring you some. Can we see it inside or no?
Yeah, so we actually have a room that is safe to look through that window, so you can see the treatments that we do.
Okay, so I'll have Francesca show you guys that, and I'll go check it out. Thank you.
You're welcome. My pleasure.